If you're currently undergoing or considering chiropractic care, you're not alone. Millions of Americans each year are choosing chiropractic care as an alternative to other forms of healthcare. The list includes sports organizations, athletes, and entertainers. So what do users of chiropractic care think about the care they've received? Let's look at the facts. There are about 95,000 doctors of chiropractic in active practice across the globe. Each day, over 1 million adjustments take place across the globe. Chiropractic is the second largest healing profession in the world. 90% of chiropractic users feel their treatment is effective. Nearly 80% of the chiropractic users felt that the cost of chiropractic treatment was reasonable. How knowledgeable is my chiropractic doctor? Doctors of chiropractic spend years studying and perfecting the art of performing manual therapies, as well as administering other natural, non-invasive treatments. Treatments involve a technique called spinal adjustment. So what is a spinal adjustment? Spinal adjustment is a treatment using the doctor's hands or instruments to apply a light force to one joint or a group of related joints to restore normal function. Through the use of adjustment, the doctor seeks to provide relief from symptoms, improve joint and muscle function, and speed recovery. What types of symptoms will be relieved through spinal adjustment? A misaligned lower lumbar vertebrae may cause lower back pain, leg pain, and numbness. It's this same vertebrae that supplies nerves to the lower legs, ankles, and feet. A misaligned middle lumbar vertebrae may cause lower back and hip pain. Nerves from this vertebrae are supplied to the bladder. A misaligned upper thoracic vertebrae may cause mid-back pain. Nerves from this vertebrae are supplied to the heart. A misaligned lower cervical vertebrae may cause neck pain, arm pain, and numbness. Nerves from this vertebrae are supplied to the thyroid gland. And finally, a misaligned upper cervical vertebrae may cause neck pain and headaches. The nerves from this vertebrae are supplied to the brain, middle and inner ear, and the pituitary gland. These misaligned vertebrae may interfere with the functioning of your nervous system. This is called a subluxation. What causes these subluxations? Slips and falls, strains and sprains, poor posture, poor sleeping positions, motor vehicle accidents, work injuries, sports injuries, small repetitive stresses, childhood falls, and even the birth process. As these stresses are applied to the body, they create misalignments and eventually nerve irritation. Your chiropractic doctor, through a series of spinal adjustments, will move the vertebrae back into proper alignment and alleviate the pressure on the nerve. What happens when a misaligned vertebrae goes untreated for a lifetime? When left untreated, misalignments can cause spinal degeneration. Here we see a set of vertebrae with normal curve, good disc spacing, and good bone structure. We'll move now to a mild level of degeneration in which we see the loss of good curvature. Now a moderate level of degeneration causing further loss of disc space. And eventually a severe level of degeneration in which we see the disc space has narrowed dramatically and joint flexibility reduced significantly. So what are the phases of patient care? There are 3 phases: the intensive acute phase, requiring more frequent doctor visits during which patients are experiencing acute symptoms of pain. There's the rehabilitative phase. Here doctor visits are reduced and pain symptoms are reduced or eliminated. And then the maintenance or wellness phase, in which the patient experiences maximum benefits from care and treatment frequency is at its lowest. Let's illustrate the 3 phases of care. Treatment frequency is highest during the intensive or acute phase. Through constant care, the patient will eventually cross through the pain threshold, where symptoms of pain become reduced or eliminated, and into the rehabilitative phase, where the supporting muscles are retrained to their original or natural state. Eventually, the patient will advance into the maintenance or wellness phase, where ligaments are strengthened and the patient experiences maximum improvement. The road to better health requires commitment from both the doctor and the patient. Once a treatment plan is established, progression through the phases of care requires consistent care, since each treatment builds on the one before. Through this commitment, better health and a higher quality of life can be achieved.